The South African Health Products Regulatory Authority has now approved changes to the storage conditions for the Pfizer COVID-19 vaccine. They now allow it to be stored in a refrigerator for a period of a month. This extends the shelf life of the doses from 5 days to 31 days. It will help to speed up the vaccine rollout because the new storage conditions could result in simpler logistics, cheaper equipment and less waste. Aisha Abdul Karim of the Bekasisa Center for Health Journalism joins us now. Aisha, good afternoon to you. I mean, this is going to make a big difference, right? It's going to make it a lot easier to use this vaccine.
Yeah, so essentially what it means is that that vaccination sites can now keep more vaccines on site, because previously, once the vaccine had been thawed, it could only be kept in a fridge for about 5 days, which meant you had to keep smaller amounts of vaccines on site for in case you didn't use them up because you don't want to waste doses. And what this means is that now that you can keep them in a fridge for up to a month, sites can start ordering much larger amounts of vaccines that they can then keep on site for a longer period. And that also means that more people can get vaccinated because you can do more immunizations per day. And if doses don't get used, you can keep them for much longer, about 6 times longer. So it really makes the day-to-day logistics of the vaccine rollout much easier now that we can use these defrosted vaccines for such an extended time period.
It also makes it a lot cheaper, I imagine.
Yeah, so essentially Pfizer was quite challenging logistically because it was one of the vaccines that required the coldest storage, needed to be kept at -70, which requires very expensive specialized freezers. What South Africa is using currently is its second storage option, which is you can keep it at -20, which is a standard freezer, but you can only keep it at that temperature for 2 weeks. So what this means is we can now use much cheaper equipment because you can put it in a regular fridge, and you can keep it for, as I said, a month long. So it really cuts down on a lot of the costs that are required for maintaining a frozen vaccine in this type of rollout.
So, I mean, the real difference, I imagine, might be in rural areas, and this is where there are big concerns now about distributing vaccines. This could make a big difference for them.
So essentially what we're doing at the moment is trying to keep the Pfizer vaccines out of rural areas. They're primarily aimed at going towards more urban and metro areas because, as I said, they up until now have required either very low storage or freezer storage. And while this, in theory, the fridge temperature could make these vaccines more accessible to rural areas, unfortunately, they still need to be transported frozen. So the vaccines arrive frozen and they're sent to the vaccination sites in a frozen state. They're only defrosted and thawed at the site when they're ready to be used, ideally. So what that means is, and because also the Pfizer vaccine, it's made out of this sort of genetic material, it's quite sensitive to temperature and it can degrade if it's taken out of its frozen state in like not the right way. So the difficulties with sending it to rural areas is it's not that so much at the site that you're worried about it, but it's the route to get there. The temperature can fluctuate quite a lot, and so you run the risk of the vaccine not being kept and maintained at a low enough temperature on the route to the vaccination site as you get into more rural areas. So it's unclear at this stage if the new storage requirements are going to be able to expand access to this vaccine in more rural parts of South Africa, but it definitely does make it easier to keep the vaccine for a longer time, especially in the sites that we are taking it to currently.
And then the Johnson & Johnson vaccine, the one-shot vaccine, the one that we want to use in rural areas, as you say, there's a sort of delay on that at the moment. As I understand it, it's because of things that are happening in the United States. When that gets released, that presumably is going to make a big difference.
Yeah, so ideally the Johnson & Johnson vaccine is much better suited towards going to rural areas because it's mainly kept at fridge temperatures, which is between 2 to 8 degrees. But the other component to Johnson & Johnson, which makes it a much better logistical option for rural areas, is that, as you said, it's only 1 dose. So that means that you limit the amount of, because there's virtually no follow-up, because you don't need people to return and come back a month later to come in, or 3 months later if we change the dosing interval. But you don't need people to come and return to get their second dose. So ideally, we would want Johnson & Johnson to go to the rural areas or places where we're concerned that people might not be able to return in time to get their second dose. But as you said, there are some delays with that currently, so we don't yet have Johnson & Johnson vaccines included in phase 2 of the rollout, and we have to wait for those to be released from the manufacturing plant.
Aisha Abdul Karim at the Becker Cisa Center for Health Journalism. Thanks very much indeed.